Hi everyone. Today's lecture about classification of skeleton. We classify our skeleton according to the position of bones to our body. We have exoskeleton. Exo means external. And we have endoskeleton, which means internal the skeleton. Second classification is according to the process of ossification. We have intramembranous ossification. The membranes differentiated and became ossified into bones. And we have intracartilaginous ossification. The cartilage cells differentiated and ossified into bones. Third classification is according to the shape of bones. According to Wickers for our skeleton, there are many types of bones in our body. Let's start with the first classification. The exoskeleton. Tooth enamel and nails are two examples of exoskeleton. Endoskeleton is classified into axial skeleton and appendicular skeleton. Axial skeleton. Your axial skeleton is made up of the 80 bones within the central core of your body. This includes the skull bone, the thoracic cage, and the vertebral column. The skull, the rib cage, and the vertebral column are examples of the axial skeleton. Second type of endoskeleton is a appendicular skeleton. We have shoulder girdle. We have the upper limb, pelvis, and lower limb. So we have shoulder girdle, arm bones or upper limb, pelvic girdle, and long bones. All these bones considered as an appendicular system. Together, axial skeleton and appendicular skeleton form the endoskeleton. Second classification is according to the ossification process. We have either intramembrane specification and intracartilaginous classification. Let's start with the intramembranous ossification. This process involves the direct conversion of mesenchyme to the bone. It begins when neural crest-derived mesenchymal cells differentiate into specialized, bone-forming cells called osteoblasts. Osteoblasts group into clusters and form an ossification center. The ossification center leads to deposition of bone and formation of our bones at the end of this process. Second type of ossification is intracartilaginous ossification. Bones formed this way include the skull and clavicle. In intracartilaginous ossification, a cartilaginous model is first formed and then replaced by bone. Long bones develop through this process, with osteoblasts eroding and replacing the cartilage matrix, leading to formation of our bones. This is in brief the process of intracartilaginous ossification. Now let's start with the third type of classification. Classification of skeleton according to the shape. And we have many types of bones. We have 206 bones in our human body. 90 of them are long bones. Humerus bone and femur are examples of long bones in our body. Then we have short bones, and there are 28 short bones. Carpal bones and tarsal bones are considered as a short bones. Then we have flat bones. We have 36 flat bones, and the sternum is one of them. It is located in the middle of the thoracic cage, or thorax. Then we have sesamoid bones. We have 4 sesamoid bones, and patella is the most famous sesamoid bone. And we have 48 irregular bones. The vertebral column in our body forms of vertebrae, which are irregular bones. So this is the end of our lecture about the classification of our skeleton. We hope you enjoy it.